Right, we've got like 6 slides here, so bear with me when we talk briefly about infection and HIV. So what do we have? Infections. Infections occur when a pathogen invades the body and replicates, right? And that infection causes harm to the host, if we're talking about it in a sci-fi way. So the host is the person, and there are 3 types of infections. Localized, so infection that's limited to a small area. So think about a small scratch or cut that is just in that particular area. Disseminated, infection that is spread to areas of the body. So think about that bite or scratch or cut that has caused the for example, if it's the leg that has been impaired, that particular so you've got a scratch or cut on your foot, and then that whole leg has streaking or inflammation. Systemic, so infection that is spread throughout the body, often via the blood. So just like the blood brings nutrients and also tries to filter and clean stuff out, the blood can also be the pathway in which infection can spread. So types of pathogens: bacteria, viruses, fungi, protozoa, and prions. Emerging infections. So we've talked about this a little bit when we talked about the vaccinations. We talked about pertussis in the respiratory chapter. So that was one that was considered for children, and now we're seeing it in adults. And so you can see some of the other ones. The plague, which is often from, well, just the definition from for the plague in this sense are the infections that are from dead wildlife or dead rodents, and those infections can actually spread to humans and get them very sick. So some of these other things. Tuberculosis is considered a re-emerging infection because we're seeing it more. Some other examples: Lyme disease. Further emerging infections. So the increased incidence that threatens to increase in the immediate future. So HIV, AIDS, swine flu, peptic ulcer disease, because what do we remember about peptic ulcer disease? It can be from an infection. West Nile fever, acute and chronic diarrhea. So those are from either viruses or bacteria that are very resistant. So you can see on the right corner of this slide antibiotic-resistant organisms: Staphylococcus aureus, Staphylococcus epidermidis. I'm not going to say all these, but these are, when you're working in the hospital, you'll see that's why we have patients on contact precautions, because we want to continue to decrease the spread of specifically antibiotic-resistant organisms. Healthcare-associated infections. So these are like the methicillin-resistant Staph aureus or vancomycin-resistant enterococci. Those are that are easily spread in the healthcare industry because it's spread to those who have decreased immunity, and those in the hospital have decreased immunity, right? So infection precautions are standard precautions and transmission-based precautions. We've kind of talked about that. We've talked about tuberculosis, and we've talked about MRSA before. And then the final slide on here. So HIV infection caused by HIV, a retrovirus, and it causes immunosuppression. It's transmitted as a result of blood, semen, vaginal secretions, or breast milk. Clinical manifestations. So, a patient is screened often from lifestyle. So those who have a history of blood transfusions, IV drug use, what we consider risk behavior, including men having sex with men, women in the pleasure industry, those with multiple partners and unprotected intercourse. So those are persons you might be screening when you're hearing their history. So patients that have HIV have fever, they may have multiple swollen lymph nodes, loss of appetite that doesn't seem to be going away, persistent fever, drenching night sweats. So what does that sound like? That also sounds like tuberculosis, right? So, so someone with HIV that has had a chronic infection, they actually might have tuberculosis simply because they're immunosuppressed. Diagnosis, standard antibody tests, CD4 and T cell counts, CBC with differential, genotype and phenotype assays, and your treatments. Monitoring your HIV disease progression, and your managing symptoms.